I'm Dr. Suheil Simaan. I'm a cancer specialist and American board certified in surgery. I'd like to talk about a common disease, which is skin cancer. Now, skin cancer is caused usually by two things: increased exposure to sunlight and fair skin. So that's why we see a lot of cancer in those people who are fair, who have light skin, and who are exposed to a lot of sun. That's why we advise, especially those that are prone to develop skin cancer, to avoid exposure to sun, mostly between 11 o'clock in the morning and 3 o'clock in the afternoon, where the sunlight is really perpendicular and has, especially in summertime. So they usually manifest in skin growth, and they are slow growing. For example, in the face, where the face is exposed to sun more than others, because other parts of the body are usually covered, the face is exposed most of the time. So we have lesions in the face, in the lip, in the scalp. So we have to watch these. Now, the aggressive type of cancer of all cancers of the skin is the melanoma. Melanoma is the cancer that arises on nevi. We call it shami, nevus. Now, many of us, every one of us has 10 to 20 nevi in his body. These are, especially if the nevus is hairy, that's usually benign. But if the nevus, shami, increases in size, or if it was, let's say, fair, it became black, we have to watch out for this and remove it as soon as possible before it progresses, because these nevus, cancer of the nevus, or we call it malignant melanoma, they are very aggressive. They usually metastasize. They spread into the nodes and into the lungs. But most of the skin cancers are either basal cell cancer, which are very slow growing, they don't spread, or squamous cell cancer, which are a little bit more aggressive, but also completely curable by excision. And we have to watch out always for enlargement of the lymph nodes near the skin cancer. If it is in the leg, we have to look for nodes in the groin. If it is in the face, we have to look for nodes in the neck. Anyway, if we are all aware, that's why we depend on awareness of the people about skin cancer, especially for those who have fair skin. Always watch out, avoid skin burn or sunburn. People sometimes they go to the beaches and they are keen to develop to have skin tan or suntan. That's really dangerous. They should really have sunscreen. They should have some ointment, and they avoid skin. They should avoid the sunshine, which is very burning at noontime. Okay, thank you very much.